This is Dr. Mukhtar Yerima. Welcome back to my channel. Today, I am going to talk about postpartum depression. Postpartum depression is the kind of depression that occurs after childbirth. So it only affects women of childbearing age who have delivered. Postpartum depression actually occurs on a spectrum from the mildest form, which is called postpartum blues or baby blues, to the severest form, which is called postpartum depression. Baby blues is the mildest form of postpartum depression, in which the mother would be having mild depressive symptoms, would be crying occasionally, would be feeling sad or irritable, but it does not incapacitate her completely, and it lasts only a few days. Usually within 3 to 5 days, the symptoms of postpartum blues went off. They usually went off completely and they are gone. Now, this postpartum blues occurs in over 70% of women after delivery. On the other hand, postpartum depression affects about 15% of women after delivery. It is slightly higher than that in developing low and middle income countries like Nigeria, and slightly lower than that in more developed high income countries of the world. So how do you know you have postpartum depression? Usually the depressive symptoms that you find in postpartum depression are not much different from what you have in people who become depressed outside of childbirth. However, there is a slight difference that involves the feelings and the thinking of the mother towards the child that she has just delivered. The depressive symptoms that you usually have after childbirth are normal depressive symptoms, and they include sustained feelings of unhappiness, loss of interest and pleasure, decreased energy and activity, poor sleep, loss of concentration, feeling guilty, thinking that you are useless, hopelessness, thinking of death, or even thinking of dying or thinking of suicide. The ideas of guilt that are found in postpartum depression usually have something to do with the motherhood that the mother is just entering into. So the woman is likely going to start thinking that she is a worthless mother. She is not going to be a good mother. She's going to be a useless mother. So all these are the ideas of guilt and unworthiness that are centered around the theme of the childbirth. The symptoms to do with the baby include lack of attachment, lack of love, lack of care towards the baby. The mother would simply not feel like wanting to take care of the baby. The mother will feel as if this is not her baby. She will not feel the need to love her. She will not even feel the love in her mind. She will not feel the need to take care of the baby, to feed the baby. She will just kind of feel completely detached or unattached to this baby. Now, in severe cases, the mother might even start feeling that she should hurt this baby. The mother would feel the impulse to hurt the baby, to harm the baby, and there are even times when the mother might even actually go ahead to kill the baby. This is as a result of a number of reasons. Sometimes in severe depression, in this postpartum period, the mother might feel that this world is terrible, so why should I allow my baby to survive in this terrible world? I had better killed her. So this is some of the reasons that make people to eventually end up killing their babies in the postpartum period. So why is it important? Well, as we can see, it is associated with a lot of distress, a lot of disability also. The mother is going to have difficulty doing virtually anything. She would not be able to go about her normal day-to-day activities. She will be utterly incapacitated, in addition to the feeling of distress. Additionally, the baby is in potential danger because this mother, the least she might do is to refuse or to be unable actually to take care of the baby, to feel detached from the baby. And in severest cases, she might even go ahead to kill the baby. So you see, it is that serious. So why does postpartum depression occur? It is because of a number of reasons. It could be biological, because after childbirth, the hormones in the mother that have been helping to maintain the pregnancy and to maintain the baby after delivery are no longer needed. So those hormones, especially estrogens and progesterone, will crash, and within 1 to 3 days, they go back to their pre-pregnancy levels. So this sudden change in this estrogen and progesterone hormones is believed to be somehow responsible for that. The levels were very high during pregnancy. it is believed that they are more than 10 times their pre-pregnancy levels during pregnancy. And then after pregnancy, within 1 to 3 days, they crash back to their pre-pregnancy levels. So you can imagine that the body perhaps might feel this as a sudden change, and that might make some women who are somehow vulnerable or at risk to have this postpartum depression. Another hormone that is probably implicated is one other hormone called thyroid hormone tends to reduce in its levels in the body. So that might also probably explain it. Additionally, some psychosocial factors might explain why some women might have this postpartum depression. Remember, after childbirth, especially if this is your first pregnancy, you're going to be a completely new person. You have welcomed a new person into your life whom you're going to be responsible for the rest of your life. So this means that there are going to be changes in your life. Your time is now not entirely yours. The child has got to also be given some time. Additionally, you have to be responsible for this person throughout their life. And also, your sleep might not be as it used to be. And then also even your body, before this pregnancy and delivery, your body might probably be different. Now that you've delivered, you might notice some changes. And so all of these factors might come together in addition to all those hormonal biological changes we mentioned to contribute to making some women develop this postpartum depression. It is not all women, like we said, that would have this postpartum depression. That means there are some women who are more at risk. So what are those risk factors? What are those things which, if they're there, make it more likely for you to have postpartum depression? So there are a number of them. But I will just list a few. So for instance, age. The younger the mother, the more likely is she to have postpartum depression. And that's why it is commoner in women during their first pregnancies. Another risk factor is if the woman has had depression earlier in life, and also if she has had some depressive symptoms during pregnancy. Another risk factor is if she has been going through some stressful life events. She has been going through some serious stresses. Another risk factor is if this pregnancy is somehow unplanned or is maybe unwanted. Family history of depression also increases the chances of having postpartum depression. Women who have low social support, maybe no support from the family, no support from the husband, no support from the community, these women again are more likely to have postpartum depression. So what can we do if we discover that we or our family members or our friends have these symptoms and we think it is postpartum depression? So the idea is to identify it and to recognize it and to seek for immediate medical attention. And of course, although this condition is likely to occur in about 15% of women, like we said, after delivery, it is easily treated. There are effective medications in the hospital that can easily treat the condition. And also some other psychological interventions are available which would further increase the support that the woman can have to make her recover completely and fully. I want women to also realize that if this depression occurs, it's not your fault. It's not that you are a weak person. This is an illness. So families and friends and the mothers that develop these conditions should realize that it is a medical condition and immediate medical attention should be sought. Thank you for listening.